Good evening, everyone, and thank you so much for tuning in to the first broadcast of a Breakthrough Talk Show. With me here tonight, I have a special guest, as we'll be dropping off information and tips in our community about how to be proactive during this flu season and overall health care. So with me here tonight, I have Dr. Teresa Robert. She is currently a family nurse practitioner at Westside Family Medical Center here in Kalamazoo. She is very active as an independent certified nurse case manager. She's a clinical instructor at Kalamazoo Valley Community College, where she teaches graduate nursing students, as well as she has held the position of CEO and owner for 12 years of Divergence of Excellence, which is a home health care agency, which their focus is to provide care in homes for catastrophic clients. Dr. Roberts, thank you so much for being here with me tonight.
Thank you so much for having me.
Now, recently I've been concerned about the growing cases of the flu that's been reported this year. I think I read something about it's around 1,500 nationally. What's your take on that?
Well, the U.S. has experienced the worst flu season in some recent years this year. And with the Centers of Disease Control, they've actually declared it epidemic. So my take on it as a provider is confirmation that everyone needs to be proactive and receive their vaccine and get the flu vaccine every year.
Now, some people say that the flu shot makes them get sick. So they don't want to get the flu shot if they're going to get sick anyway. So what's the truth to that?
Most of the time when someone gets a flu vaccine and they get sick, it could be secondary infections like a bronchitis, sinusitis, or some other disease process that's not the flu. So there's a lot of, we need to debunk that myth, yes.
So what are some of the symptoms that we should look for when we just need to go seek medical attention?
Well, when seeking medical attention for the flu, with this flu, what we've been seeing in practice is a lot of the patients come in with just a cough and body aches. So you can present with a cough, body aches, fever, respiratory issues, upper respiratory congestion, so different types of things like that. So when you start to seek medical attention, when you start to have shortness of breath, you get dehydrated. So different things like that, you should go to ER. The elderly, very young children, infants, those are the ones that need to seek medical attention early to be treated.
Now, when we're sick, a fever is the biggest thing that just makes us just down and just doesn't want to do anything. So what's that range in fever, or how long does it have to last before we really should go get treated?
Most parents, and we really want to get this out, people want to come to us with a fever. By the time they get to a provider and you have 103 fever, you should have taken Tylenol. We believe you when you say you have a fever. So it's really important that when you develop the flu or any other sickness, to take your medication as ordered every 4 hours if you're taking Tylenol. Make sure you don't go over the recommended doses, and that's something someone can get over the counter. So it's really important to keep the fever at bay and take Motrin, Tylenol, whatever your doctor prescribes for you. So you don't have to wait to come to the doctor to take care of the temp. But we want you to stay around 98.8. 99 is a low-grade temp, and that's okay.
Now, where can people go to get information regarding the flu right now that's coming out, or any other things that may be big in our community? Like, what's a good website or places that should go to get information?
Well, the best place at this point would be the CDC. And when people are investigating or Googling, as we say, right? Everybody want to be Google doctors. So when they're Googling information, they want to go on cdc.gov. So you look for government websites. That's going to give you mail, websites that will give you research studies from medical journals, right? You just don't go on websites that give you false information, take apple cider vinegar, or don't give you the information you need. So cdc.gov would be good. Your health department. A lot of now with the pharmacies, Walgreens, you can walk up and ask them information, pharmacists, and ask them about the vaccine also.
Okay. So I know, me personally, Google.com is like my best friend. So now we know more so the CDC website and Google.gov are some websites to go to kind of get some information, but the best information is going to come from your doctor.
Absolutely. It's really important if you have insurance to utilize that insurance. You know, we fight as Americans for health insurance. That's a big policy point going on right now. So if you have insurance, go see your doctor. You know, so they're going to give you the best information. They know you individually. They know your chronic diseases if you have any, and they know preventative medicine. So it's really important to go in and talk to them if you have questions.
So I know that preventative care is like your baby. So what information are you getting out there that you want to continue to get out there just to let people in our community know, you know, how important it is to be proactive?
Well, in practice, I'm a really big advocate on lifestyle changes. I'm not a big, as some people say, pill doctor. You can't come and say, I'm gonna give you a pill for everything. Sometimes the way you change your lifestyles make a big difference. So for instance, patients that come in that want to lose weight, you know, I work with them we don't focus on the numbers on the scale. What I do a lot is have them bring in their meal plan, what they eat already. It's really important for me to tailor my program to their lifestyle. For me to say, go eat chickpeas, and that's gonna make it better for you, right?
No, not for me.
It's not always a good thing.
Right.
You know, so if you come in and say, well, I eat black-eyed peas, I need to be able to teach you and give you the information to make you more successful with what you already do. So that's one thing that we do in practice. I encourage patients to always get their annual mammograms, you know, and I know sometimes studies change, but I still go with the practice I learned. You know, I do follow studies and have people come in and do their annual exam, get lab work, you know. In Michigan, we don't get a lot of sun. Vitamin D is important. Those are things that you should speak to your doctor about.
Now, I know that also you are currently teaching some classes at Christ Temple Church. So what's the information that you're doing there?
Absolutely. I'm teaching about, it's a diabetic education class within our church home. You know, you start, whatever you do, you start at home. And so that was important for me as a provider to give back, you know, as a medical professional and teach people what diabetes is about. Diabetes is an epidemic, right? And so I wanted to give back. And so what we do, we teach not only the diabetic patient, we teach family members. If you know a friend that's a diabetic, anyone can come to the classes. And we educate them on what diabetes is, meal plans, how to eat, how to monitor their diabetes. I don't prescribe for those people. They bring in the information from their physicians and I give them information to take back. And then that way they're more educated when they sit down with their providers. And then they're able to talk to them and have a candid conversation about what do I really need to do? And is this medication or is this diet plan right for me?
So what's new? Like what's up and coming in the healthcare world right now?
Wow. Kind of hard to say with them fighting in Congress. I don't know. What's new? Well, I think for everyone, it's not new, but I think everyone should take time to really start to evaluate their lifestyle. You know, we're so fast at life. We want that microwave lifestyle, right? So when we stop at fast food restaurants and we're not back in there cooking those good meals, you know, where you don't have all the starch and the other stuff in it. I'm really a big advocate about eating organic foods. And the reason why I say that is because we have antibodies and different things that are put in the foods. So it's really important to know what you're eating, right? Reading those labels. So if I had to say it's something new, not really new, it's an old thing. Start to just take care of your diet and exercise, vegetables. You know, go back to the old ways where we had a lot of fruits. You know, we give kids these packets and snack stuff that we give them for school, and sometimes it can be unhealthy. And it starts at that age. We got to start with our young, right? Because we only have one of these, and we can't always replace them. I know they got new technology coming out, but we have to take care of what we got, and these organs are really hard to replace.
So it's definitely very important to at least pay attention to our bodies because our bodies tell us something.
Absolutely,
right?
absolutely. And then a lot of disease processes like hypertension is that silent killer. You don't always know what's going to happen, having a stroke. You know, we try to get information out there to our patients and through different programs that they have at different hospitals about hypertension, diabetes, stroke. And these things hit families quick and are very devastating, not only to the family, but financially. So it's prevention. That's the biggest thing. We got to prevent it.
So now we know the flu vaccination is there to help us, not hinder us. And that it's really important to listen to our bodies. Our bodies are only going to tell us something when something's wrong. So we want to make sure that we get out there, we get to those doctor's appointments, keep up with our annual physicals, and just be proactive. Again, I want to thank you so much for coming in tonight and just getting this information out there. So tune in next month where we're going to talk about mental health. I have 2 special guests with me as we'll get the information out there of how not to be afraid to talk to someone and how talking to someone can also lead to a better life.